Hamilton.
I thank the Minister for that answer. Across Scotland, dental consultant vacancies are going unfilled and patients are left waiting. The British Dental Association described the figures acquired by Spice and the Scottish Liberal Democrats as eye-watering, and they said patients can effectively expect to wait much longer. The BDA said these long waits are being driven by a failure on prevention and a failure to invest in the workforce. The most recent ISD figures show, quote, a noticeable drop in NHS dental staff, down 14.7% in the last 5 years alone. Can the Minister explain why?
Minister.
There was 2 points made in the BDA. So one was workforce, which I'll come to shortly, but the other was prevention. And I do think that prevention is an area where we are making substantial success across Scotland. So the Child Smile programme is making a real difference, so helping make sure that children know how to brush their teeth properly, providing fluoride varnish applications. And the next stage in that we'll be announcing under the Community Challenge Fund of the Oral Health Improvement Plan. We'll be announcing which projects, bespoke projects, will be taken forward to aimed at reducing further the health inequalities in children in terms of their oral health. In terms of the other area, one of the big challenges around well, first of all, one of the challenges we no longer have in terms of dentists is that now there's very few people who can't access an NHS dentist. So when we took over in 2007 as a government, the huge numbers of people unable to access an NHS dentist, and we've really managed to turn that around. So, you know, sometimes I think it's important to say, you know, where progress has been made, and so I think we should raise some acknowledgement of the progress and thank our dental colleagues for rising to the challenge and making sure that people can, in the first place, access NHS dental practices. In terms of some of the specialist areas, one of the big areas, I had a chat with the BDA just last week, and one of the challenging areas is around anaesthetic consultants, and that leads to a number of the waiting times. But even there, we can see that we have managed to increase the numbers of anaesthetic consultants by 41.7% since 2006. So that's moving from 549 up to 778. I'm in no way suggesting that I think everything is rosy, and I do accept that some of the waits that we know about, in particular some of the more challenging cases, are entirely unacceptable, and particularly when we're talking about children who are often in pain. We need to continue to do better around that, but I think we are managing to make a difference, and the waiting times improvement plan is designed to make that even better.
Hamilton.
I'm grateful to the Minister for that answer. I have a constituent who requires both inpatient and day case support, but she isn't getting any treatment whatsoever. In 1995, Angela Mulhern fell victim to William John Duff. He performed a series of unnecessary and incompetent dental surgical procedures, which have caused tens of thousands of pounds worth of damage to her teeth and jawbone and left her in constant pain. Ms Mulhern underwent this treatment as an NHS patient, yet has not had the necessary remedial work carried out or even offered by the Scottish NHS. Will the Minister agree to meet with Mrs Mulhern and I?
Minister.
I think if in the first instance, if Mr Cole-Hamilton wants to write me about a case which I've absolutely no awareness of right now, then we can discuss how we should take that forward. But